I'm Garvin Lynch, and this is Lynch's Pharmacy Health Video Series. This video is on constipation and mainly treatments. So treatment for constipation should only really be used when increasing fibre and fluid intake hasn't worked. In which case then we use laxatives to treat constipation. There are four main groups of laxatives and they all work in different ways. The four groups are bulk forming laxatives, stimulant laxatives, osmotic laxatives and fecal softeners. So if we start with the bulk forming laxatives, the most popular would be Fibogel, which contains a laxative called Espigala husk, which is a fibre supplement and works in very much the same way as fibre in that it adds bulk to the faeces. It draws water from the body into the gut and makes it easier to pass feces. Fibogel is usually taken one in the morning, one in the evening. It's very important to drink plenty of water to replace that water that it uses, at least 2 litres a day. Another bulk forming laxative is unprocessed bran that you can buy and sprinkle it on cereal or mix it in fruit juices. It might be a cheaper alternative. There is also this project called Fibogel Mebeverin, which is the same ingredient as Fibogel, Espigala husk, but also has an extra ingredient called Mebeverin, which is an antispasmodic. This is good if they've pain or cramps in the stomach. The Fibogel Mebeverin can be used from 12 up and the Fibogel from the age of 6 up. The next category is the stimulant laxatives. The two most popular ones are Senna, which is Senocot, and Bisoprolol, which is Dulcolax. These stimulate the nerve endings in the gut, and this gets the gut moving and passes any blocked feces out. So it's basically a kickstart for the gut to get things moving and relieve any constipation. You usually get an effect from these after 8 to 12 hours, so they're usually taken at night to show their effect the next day. So you take them before you go to bed, and when you wake up in the morning you'll have an urge to go to the bathroom. Whereas with the bulk forming laxatives, they might show an effect within 12 to 24 hours. More often than not, it will take a couple of days to show any effect. The stimulant laxatives are by far quicker acting than the bulk forming laxatives. The stimulant suppositories act a little bit quicker. These could work within 20 to 60 minutes. Dulcolax tablets and suppositories, whereas Senocot do tablets and syrup. The suppositories can be used from the age of 10 and up, usually just one at night, and the Dulcolax tablets can also be used from age 10 and up. Again, at nighttime dose is ideal. The Senocot syrup can be used from 2 years of age and up, and the Senocot tablets from 12 years of age and up. So they're the stimulant laxatives. Then we have the osmotic laxatives. Lactulose would be the most common one, which is contained in both Dufalac and Laxose products. Osmotic laxatives again basically draw water and keep water in the gut by osmosis. This softens the feces and makes them much easier to pass. These will take a couple of days to work, so not ideal for urgent relief from constipation. They can be used in children of all ages except for Laxose, which is just licensed to as young as 2 years old, but the Dufalac can be used in any baby of any age. So that's the osmotic laxatives. The final group then is the fecal softeners, the main one being the microlax enemas. These wet and lubricate the feces in the gut, making them much easier to pass. The microlax comes as one enema and just give them one as needed. If the child is under 3, the nozzle is just inserted halfways and again given as needed. Liquid paraffin used to be recommended as a fecal softener, but not anymore, as it was found to have some nasty side effects. If a fecal softener is needed, microlax is certainly a good choice. In terms of which one to use and which one would suit best, generally treatment with a bulk forming laxative is tried first, so the Fibogel is tried first. If this doesn't work, or the feces are still quite hard, then an osmotic laxative So Laxose or Dufalac would be used next, or in addition to a bulk forming laxative. If the feces are soft but still not being passed, then a stimulant laxative like Senokot or Dulcolax could be used. All of them should only be used for a short time. Some people get into a habit of taking laxatives regularly for a long time just to keep their bowels regular. This really isn't a good idea, especially for laxatives that bulk form. Using laxatives long term can have effects in a whole host of areas: bone strength, bone growth, vitamin deficiency as well. So if possible, treat constipation naturally as far as possible with fibre and increase fluid. And if that doesn't work, choose the best product that will most suit yourself, the individual. So if you have any questions, you can contact me through the live pharmacist on the website, or email me, or call into Lynch's Pharmacy up Maryborough Hill in Douglas.